53 million Americans are unpaid caregivers to their family members. All of that according to a report from AARP and the National Alliance for Caregiving. While providing care for our loved ones, of course, it can be rewarding, but it can also take a toll on our mental health, and it can create a significant financial burden. Statistics show that this responsibility is now falling on the shoulders of an even younger generation. Jennifer Levin joins us now. She is the author of Generation Care, The New Culture of Caregiving. We are also joined by licensed clinical psychologist, Dr. Tasha Brown. Thank you, ladies, both for joining us. Jennifer, if we can, I want to start with your personal story because you became your father's caregiver when you were in your early 30s. Can you talk about sort of how that experience is different when you are so young?
Absolutely. When you are younger in age, it is less likely that one of your friends has gone through the experience or is going through it at the same time. Maybe when we look at the model of a caregiver, it's somebody that's our parents' age, and they often have a language on how to talk about this with their friends. So when you're younger and you're experiencing this, it feels very alone, feels very isolating, and you can really retreat into yourself and create this silence around your experience that makes you feel like an outlier for all of your peers.
I love what you said about the isolation, because this is happening as Dr. Tasha. We're experiencing this loneliness epidemic in this country. So talk about how caregiving really affects this generation of people and sort of can add to that mental load.
Yeah, when we talk about younger people providing caregiving services for an older generation, it's so important that we talk about their mental health, because we know at this time there's a lot of identity development, formation happening. And so some of the daily things that younger people may be doing, caregiving is taking them away from some of those activities. We also know that it can delay some of those developmental milestones like family planning, relationship progression, and also lead to that social isolation that Jennifer just talked about.
I love that you mentioned the piece about identity, because, you know, I feel like when these things happen, whether it's caregiving, sickness, even if you're dealing with like parents' divorce or something like that, in your 30s, like that's when we're trying to build our own lives. That's when we're trying to figure out what marriage or partnership or whatever it looks like for us, right? What do you think, Jennifer, is most misunderstood about the role of being a caregiver to a parent?
I think that people don't even self-identify as caregivers. When you're particularly this age, I thought of a caregiver as a hired aide or as an older, often woman, caregiving for a spouse or an elderly parent. And so I never thought to take on the word caregiver for myself. And so when you are younger and you're taking on this role, it really feels so different, as you were saying, from anything else that you're seeing around you when you don't have that modeled back to you.
But there's not only this mental cost, there's also like a real financial burden. Tell us a little bit more about that, Dr. Tasha.
Yeah, we know that the financial burden of caring for a loved one can become very real. On top of those mental health consequences such as brain fog, difficulty sleeping. We also see sometimes regression and changes in the relationship that you have with your friends, and also your relationship with the person that you're caring for, all of which can really significantly impact your mental health on a daily basis.
So what do you do about it? Jennifer, what's your message to other young caregivers out there?
I would say find support from peers your age, because then when you have your experience reflected back to you, you can find the language to talk about it, and that silence doesn't need to exist in the same way. You can also talk about, as you're discussing, the changed relationship with your parent, if that's who you're caring for, and the role reversal of you taking care for them. It really causes this emotional toll. And when you have others to talk about that experience with who are going through the same things, you can get advice, tips, and you don't have to invent the wheel on your own.
Jennifer Levin, Dr. Tasha Brown, thank you so much for an important discussion that I know affects a lot more families than we even realize are out there. Stay right here. You're watching NBC News Daily.